Hello and welcome. I'm Steve Rothschild. I'm president of the Health and Medicine Policy Research Group, and I'm joined tonight by four of our award winners for this year: Dr. Kristi Kirschner, Dr. Preethi Pratap, Dr. Keiki Hinami, and Marta Pereya. And it's just a pleasure to see all of you. I would rather that we were doing this in person, as I'm sure everybody else would, but it is nonetheless maybe even more important in a difficult time that we have this chance to talk and learn about the work that each of your organizations is doing, and in particular around issues of health equity. Each of you has worked tirelessly for vulnerable populations. Kristi working with people experiencing disabilities, Keiki persons working, experiencing homelessness, Marta with limited English-speaking adults, and Preethi with really the front line, the essential workers that we've been talking a lot about over the last few months, and the people who are often behind the scenes. I'd like to hear a little bit about what health equity means in your work, in the work that your organization, Preethi, the Great Lakes Center for Occupational and Environmental Safety and Health Equity. What does that mean to you guys? It's in your name.
Yeah, we are the Great Lakes Center for Occupational Safety and Health. And so our focus is occupational health disparities. And for over 40 years, our outreach group has been working with grassroots organizations to advance the rights of workers, to safe and healthy workplaces. So healthy work is a basic human right, because what you do for work is so much a part of your identity, and it plays such a crucial role in your social, emotional, and physical well-being. So our mission in our organization is that every person has a right to healthy work, which means that there has to be equitable access and opportunity to find and engage in healthy work that provides a livable wage, work where your workplace is safe and healthy for you, where your employer is committed to your well-being also, and where you have some benefits like paid time off, where you can spend time with family and feel that you are growing and doing something meaningful. So that's, so in our fight for this occupational health equity is that all workers deserve that right to healthy work.
I love that word meaning, and that's so resonant. Kristi, I have a sense that that's a big part of the work that you do, is the ability to be respected and have meaning.
Yeah, I mean, I've worked with people with disabilities now for 30 years. I started out at the Rehab Institute of Chicago, which is now the Shirley Ryan Ability Lab. And, people with disabilities are an underserved population. Healthcare hasn't done a great job embracing healthcare access needs for people with disabilities, but more importantly, we haven't helped teach health professionals about disability. So we still are in an area where there's a lot of bias against people with disabilities. What are the goals of medicine? And how can we help give people the tools to rebuild their lives after disability? So when I think of my work as a rehab doctor, I'm a facilitator for their self-determination, but they need tools and resources to be able to live in the community, to be able to go back to work, to be able to, get married, have children. I mean, all of these things are, issues that at core are part of what give our life meaning. And we don't have a infrastructure that is great at making this available for all people, particularly people who have Medicaid and publicly funded insurance. So a lot of my work has been, I started out thinking about reproductive healthcare services for disabled women because they were nowhere in the healthcare system. And they had pressing needs, and they had such awful stories to tell us, about the healthcare system and how they were treated. But, my work over the years has spanned from the Gold Coast to safety net hospitals. And I've invested my energies recently in Medicaid, because I think that at the end of the day, we have to figure out what are the supports and services and treatment needs that people have that we can respond to as health professionals to ensure that they're reaching their highest full potential and experiencing health.
and making people, taking people out of invisibility,
Mhm.
you know, is the first step. You know, if you don't see, what does equity actually even mean? Now, I wanted to talk a little bit about access to care, but I think if we're going to talk about access to healthcare, I want to define it broadly. What does access to healthcare look like, you know, or what would that be, you know, for each of you? And Keiki, maybe we can start with you. What would you give access to, or where do you see the priorities in terms of improving access to healthcare to reduce inequities?
Yeah. Um, there's so many places where access remains the driving problem for health-related outcomes, that the way we measure disparities. And as you know, Steve, under your leadership in organizing key stakeholders on the west side, south side, north side of Chicago, in our homeless response to the COVID pandemic, we have really begun to work on connecting people where they're where they are to the kind of healthcare resources that are necessary to effectively control the spread of the disease in the Chicago County area. You know, it's an opportunity for us to sort of recognize how we often though miss the forest for the trees, so to speak, and recognizing how relatively easy it's been to rally around one topical issue like COVID, but much more difficult to sustain this effort to direct our collective attention and energy toward the underlying poverty, injustice, and intolerance. And so that's where I think access and building easier access into care remains our future work. But to take a positive view, I do feel that COVID has been an opportunity for many of us like me to join the work that's been sort of a lifelong commitment of many of you, and then also many in the audience as well. I think it's important for people who have been in this field, our elders, to help us frame our contemporary work and the arc of the longer story. And you know, I have many folks here at Cook County Health, people like Linda Ray Murray, who makes the time to engage us younger generation of problem solvers and justice seekers to make sure that what we're doing is in alignment with the bigger work that you're all engaged in.
Yeah, so under Linda's tutelage, you're engaging in good trouble, I'm sure.
That's right.
How about others? You know, what has COVID-19 shown a light on in a way, you know, that shows barriers or issues that we have to confront? Anybody? I'll open it to everybody.
Say that you know, pandemic is showing us, or any kind of health crisis is showing us how vulnerable we all are in front of that invisible enemy. And regardless, even if you know how to speak English or you don't, obviously, if you do, that's much easier for you to listen to the TV and or the radio and read and in English, etc. But people who, again, older adults who came from all sorts of crisis situations, if you will, often when we deal with older adults, they come already, if we talk about refugees, for example, they come from countries torn by war, and crisis is ever present. And health is something, or issues related to health are definitely a #1 priority. So
If in about a minute, describe your vision of what a healthcare system would look like that was actively dismantling these structures, that was actively anti-racist, that was actively working for equity. What would you want to see? What is your vision? We won't ask how you have to get there, but just what's your vision for that healthcare system? And
I think we're all gonna end up saying something very similar, I guess, here. But my take of it is just that, you know, I think we live in a world where a very narrow set of human attributes are rewarded. Example like transactionality or linear thinking, independence, verboseness are very highly valued. And at the same time, many structural features of our society punishes people like those I've gotten to know among the homeless, who are unassuming, much more modest, and they're struggling. They're quite gentle and observant and silent. An equity-focused health system that promotes tolerance or even celebrates some of these qualities that are sometimes looked down upon, I think can help, so that we don't let our narrow judgments become barriers to all of us flourishing.
Thank you all. If our founder, Quentin Young, were still with us, he would sum this up, as he always did, by everybody in, nobody out. It's a system that is inclusive, that is measured both in its population impact, but also in those one-on-one encounters that Martha, you spoke about. I want to thank all four of you. It has been a pleasure and an honor to talk to each of you, and hopefully people listening will also feel a little bit inspired and encouraged in the work that they're engaged with. So Martha, Keiki, Preethi, Kristi, thank you so much for being with us. Congratulations, and to your respective organizations. And if you have not already done so, the program does list the reasons people were recognized today, and hope you will take a moment to look at that. So thanks very much.
Thank you so much.
Thank you, and congratulations to everybody.
Likewise, thank you.
Honored to be part of, the stage with you, sharing the stage with you.
I agree. Thank you.
Me too. Thanks.